Hello and welcome. Today I'll be showing you how to draw blood on a banana. Why? Because a banana has a nice fine vein. You see that right here? Yes. Bet you guys didn't know that. So before I get started, please hit the like and subscribe button. Let's begin. Before drawing blood, you need to make sure you check your doctor order and also gather all your supply before going into your patient room. So what you will need as a supply would be a tourniquet, you need pen, of course, the label, you need tape, you need alcohol wipe, you will need a gauze, some needles. I don't have the right needles, but the picture up there is the right type of needle that you need. You need hand sanitizer, you need PPE, which would be gloves, and one last thing that I do not have, and the picture is right there, would be some tube. All right, and of course your patient. So let's get started. Now that we have our supply, let's go into the patient room. So here we go. Into the patient room, knock, come in, introduce yourself. Hi, I am nurse, whoever, and explain the procedure to the patient. Doctor orders for me to draw blood for you to run some tests. Tell the patient, make sure you use two identifiers, which could be the patient name, have the patient state the name and a date of birth. Always check your patient for allergy because most patients are allergic to latex since you'll be using gloves. So check the patient identification band. It usually tells you what allergy that they're allergic to. Alright, so make sure you wash your hands and put on hand sanitizer. And put on your glove. Now that I have my glove on, the next step is to apply the tourniquet. So I'm applying the tourniquet to Mr. Banana right here. So on the actual patient, you apply the tourniquet right here. And the whole purpose of applying the tourniquet is to slow the blood flow to the veins and to also increase the venous filling, which just make it easier to locate the vein and to enter, okay? So I will illustrate the site that you need to look for to draw your blood because I can't really use the banana. The site to use for most adults to draw blood would be the medium cubital veins, which is in the antecubital fossa. So that vein is just pretty much this vein right here. It's just right here. I can actually feel it and see it. I'm not sure if you guys can see it, but there's a picture right there that you can use. Now that we know what site we're going to draw the blood, get your alcohol wipe and clean in a circular motion and let it air dry. While I'm waiting for it to air dry, just make sure that you check your tube, which I don't have, but there's a picture right there. Check your tubes and your needles and make sure that they are not expired because you don't want to use expired stuff. Now that Mr. Banana is dry, so just go ahead and tuck back on your skin, put it back, grab your needle, put back on the safety cap, make sure it's bevel up, go within 15 to 30 degree angle, and you should see a backflow of blood into your tube. Just go ahead and switch out the tube and make sure you release your tourniquet. Alright, and get your alcohol, get your gauze, remove your needle, recap, put it in a sharp container, and grab your tape. Tape it down, and that's how you draw blood. Make sure you label your tube and send it off to the lab. Thank you for watching. Don't forget to subscribe and hit like. Thank you.